my name is Lucy McIntyre, and this is my daily patient health reassessment video. So to start off, I would check my patient's electronic health record to check for needed orders and if there's any new orders. I would also check for recent lab values to make sure and double check everything. So as I approach my patient's room, I would check outside of the room to see if there's any markings or flags that I need to be aware of before I come in. That would be something like PPE. My patient does not have anything, so I can enter. Hi, my name is Lucy, and I'm going to be taking care of you. I'm going to provide privacy as well. Can I get your name and date of birth, please?
My name's Cole, and my date of birth is June 25th, 2005.
Perfect. I'm just going to check your band to make sure we have the right patient. Perfect, matches up with what he said. And so what brings you in today?
Shoulder pain.
Okay, and when did the shoulder pain start?
3 years ago playing baseball, and it's just gotten worse.
Okay, yeah. So what makes the pain worse and what makes it better?
Just throwing and playing, and then what makes it better is like ET and physical training.
Okay, perfect. And can you show me where this pain is located?
That's in my front tilt right here.
Okay, and does it radiate?
Yeah, it goes down through my bicep and my forearm.
Okay, and can you describe the pain to me?
It's like a shooting pain.
It's like a shooting pain? Okay. And on a scale, could you show me where you'd be?
It'd be like an 8.
Like an 8? Okay. Perfect. I'm sorry to hear that you're having some pain. So now I'm just going to take your vitals, okay? So I'm going to start off with a temporal artery thermometer, and I'm going to put it across his forehead. Okay, so his temperature is 99.1, which is normal. And now I'm going to just take his apical pulse. Okay, so his heart rate was 64, and those rates were regular, and his respiratory rate was 20, and those breaths were unlabored and regular. Okay, so now I'm just going to take your pulse oximetry. All right, and his oxygen is at 97%, which is good. Now I'm just going to take his blood pressure. I'm going to start off with an estimate by finding his systolic first. Okay, I'm just going to make sure I'm using the right blood pressure cuff. All right, looks like it is. Is that too tight?
No.
Okay. Feel for the brachial artery. Okay, so systolic was 120, and so I'm going to pump up to 150 to get that blood pressure. Okay, his blood pressure was 110/70, which is normal for him. All right, let me just get this off of you. Perfect. Okay. So now I'm just going to move on with my neurological and general appearance assessment. So, to start off, my patient is comfortable, it's not tense, and is alert. So can you tell me where you are?
I'm at the hospital.
Can you tell me who you are?
Cole.
And can you tell me the date?
It's December 13th.
December 13th. Patient is alert and is oriented to time, place, and person. Patient has no facial drooping. And can you smile for me? Perfect. And can you frown? Perfect. So patient has symmetrical face, and he's able to properly do what I ask. So his hearing abilities are there, and his speaking abilities are also there. He's able to speak properly. There's no slurring. And so now I'm just going to check his eyes and his pupillary reflex. So can you just look right at my nose? Perfect. Perfect. Okay, so we have equal constriction in both eyes. They're rounded and symmetrical. So now I'm just going to make note of his skin appearance. Skin is smooth and even and pink. All right, perfect. So if my patient was not alert, I would do the Glasgow Coma Scale, which would essentially test to see your patient's alertness. So that would test their eye response, verbal response, and motor response. My patient has appropriate verbal response, is able to respond to what I'm saying, has motor responses are purposeful, and his eye responses are also purposeful. So now I'm just going to move on to strength testing. So I want you to squeeze my hands for. Okay, so his hands are 5+ strength. And now I want you to push or pull. Perfect. You push. Perfect. Pull. Push. Perfect. And now, so both arms were 5+ strength bilaterally. So now I want you to push. Perfect. Pull. Perfect. Okay. So his feet bilaterally were both 5+ strength. I'm just gonna have you move up. Perfect. 5+ for legs as well. So can you just wiggle your fingers for me? Your toes? Perfect. Do you have any numbness or tingling? Okay. So skin looks clear. So now I'm just going to move on to his respiratory assessment. So I'm going to check to make sure that he is not on mask or nose cannula. So he's not using a mask or nose cannula, but if he was, I would check his MAR to make sure that what's being delivered is in accordance with what is on his MAR. I'd also check to make sure that he's comfortable and that it's positioned correctly. So I'm just going to, grab this. And can you tell me, have you been having any coughing recently?
Mm-mm.
No? Okay. If you did have some coughs, I would assess the regularity of his coughs, as well as the sputum, color, and the amount of sputum he's producing. Okay, so I'm just gonna take a listen to your anterior lobes. So could you sit up just a little bit for me? I'm just gonna pull this down a little bit, is that okay?
Yeah.
Okay. All right, when I press this on you, I want you to take a big deep breath. Perfect. And can you just sit up just a little bit? All right, I'm going to move to the back. Okay, my patient's lung sounds were all clear with no adventitious sounds, no wheezes or crackles. If prescribed by the doctor, I would bring in an incentive spirometer to have him practice or help with that. That would be especially if he was on bed rest and immobile. Okay, so now I'm going to move on to the cardiovascular. And with that, I'm going to check his heart sounds, auscultate his heart sounds, and I'm going to check aortic, pulmonic, Erb's point, tricuspid, and mitral. So I'm just going to take a little listen here. I'm going to pull this down just a little bit again. And I'm listening with my diaphragm. Perfect. Now I'm just going to switch to the bell. Perfect. His heart rate was regular, no bounding, no abnormalities heard. Okay, so now I'm just going to check that capillary refill. So can I see your hands, please? Perfect. Capillary refill was less than 3 seconds in his hands bilaterally. I'm just going to check his feet. Perfect. His capillary refill was less than 3 seconds bilaterally in his feet as well. So now I'm just going to check his pulses. I'm going to check his radial first. All right, they are symmetric in both bilaterally. And check his posterior tibialis. All right, his posterior tibialis is regular, symmetrical, 2+, and his radialis is also 2+. I'm just going to check his pedal. All right, his pedal pulse is 2+ as well, and symmetrical. So I'm going to check if there's any edema as well in his peripheral lower limbs. I'm checking his tibia, his feet, and his ankles. There is no edema in his peripheral lower limbs. So if my patient was wearing DVT equipment, I would check to see if they were on correct. He is not, but I would double check to make sure they're on correct. That would include Ted Ho socks. Then I would check to see if he had an IV. My patient does not have an IV, but I would like to check his IV to make sure that there's no drainage, redness, or swelling. And I would check to make sure that the rate and the delivery is the same as his MAR. So now I'm going to move on to the abdominal or the skin assessment. So I'm just going to take a look at your skin really quick. Can you tell me where this bruising is from?
It's just from cupping.
From cupping from physical therapy?
Yeah.
Okay, perfect. So besides for the bruising on his right shoulder, his skin looks even with some mild freckling and papules like acne. He's warm to the touch and dry bilaterally and is equal. He's nice and pink as well, and good blood flow. And now I'm just going to assess your skin tuger. Okay, so there's no tenting there. So if my patient was on bed rest or mobile and not really able to get out of bed much, I would use the Braden scale to check for their risk for pressure ulcers. Braden scale would check things like immobility, turnover, and things like that. So I'd use the Braden scale to check. I'd also check to see if they were on any devices like an airbed to help reduce pressure ulcers. I would also check to make sure that they would have a turnover every 2 hours, and if not, I would implement that into their schedule. So turning over every 2 hours just to reduce that risk of pressure ulcers. Okay, so moving on, I'm going to lower this, okay? And I'm just gonna bring you down to, it's a little shaky. I'm gonna bring it up, and we're just going to do a little abdominal assessment, okay? Are you comfortable?
Yep.
Okay, I'm just gonna lift this up. Perfect. Okay, so patient's abdomen is flat, not protuberant, equal. There's no lesions on his skin. And have you ever had abdominal surgery?
No, I haven't.
Okay, so he has no incisions or anything of that sort on his stomach. Okay, so now I'm just going to auscultate his abdomen starting in the right lower quadrant. Let me flip this back to my diaphragm. Here we go. I think, yeah. Okay. Maybe I didn't. There we go. Now I can hear. I'm going clockwise. Okay, my patient's bowel sounds are normal active. Now I'm just going to do some light palpitation to check for any firmness, tenderness, or distension. You let me know if anything's painful. Okay, was anything painful? There were no masses or firmness noted. I'm just going to put this down now. Okay, I'm just going to move you up. Okay, and I'm just going to ask you a few questions. Have you been experiencing any nausea recently?
Nope.
Okay, and are you able to tolerate your diet?
Yes.
Okay, can you tell me more about your diet?
Just like a lot of red meat, chicken, and then some salads, as well as like pizza and stuff.
Okay, so I would suggest that we incorporate some more fruit into our diets and reducing the red meat and incorporating a more low-fat diet. Does that work?
Yeah.
Okay, perfect. Can you tell me about your bowel movements? When was your last one?
This morning.
This morning?
Yeah.
And how often do you have bowel movements?
Like twice a day.
Twice a day? Okay. And can you point to me which one yours is?
It's this one.
Type 3?
Yeah.
Okay, perfect. All right. So now I'm just going to move on to your genitourinary system. How often do you void? Urinate.
Okay. Like once every like hour or two.
Okay, perfect. And when you urinate, is it typically cloudy, or can you describe it?
No, it's usually clear, like not.
It's clear?
Yeah.
Okay. And if my patient had a catheter in, I would check to see how much they had voided. and I would check the catheter as well to make sure that there's no swelling, redness, or anything like a UTI infection in the catheter. So you said that the urine is clear?
Yeah, clear.
Clear. Okay, perfect. And can you tell me, now we're going to move on to our skin assessment. Yes, skin assessment. Wait, no, I'm sorry, I did your skin assessment. Okay, now I'm just going to move on to your ability to do activities at home. So, are you able to move around at home?
Yep.
Yes? Okay. And are you able to do daily tasks without assistance?
Yes.
And is your home safe?
Yes.
All right, perfect. Okay, so now that I've gone over all of that, do you have any other questions you would like for me to know?
No, I don't think so.
Okay, so I'm just going to give you your call light. Your call light is within reach. I'm just going to give that to you.
Thank you.
And your handrails are up. Make sure it's locked in place, and it is. You let us know if you have any more concerns, and thank you so much for being so attentive and cooperative with me today. I will see you soon. Have a nice day.
You too.